8 silent signs that an older person may be in the last year of life, and how you can offer comfort, dignity, and love to the end. Have you ever noticed subtle changes in the behavior or health of someone you love, but couldn't explain why? Are these changes just part of natural aging, or is something deeper going on? What if the body was trying to warn that it is coming to an end, but silently? Many people believe that death in old age happens suddenly, but the truth is that the body usually emits signals months, even a year before the final stage of life. The big question is how to recognize these signs before it's too late. It is at this moment that understanding what is really happening can change everything. Knowing how to identify these early signs allows you not only to offer more appropriate care, but also to ensure comfort, dignity, and meaningful moments for those who are leaving. Let's get started. What causes these signs before the end of life? The approach of the end of life is a natural process, but often unknown even by the most attentive family members. These signs arise because the body begins to function at a different pace. Vital organs, such as the heart, lungs, liver, and kidneys, start to work less efficiently. The metabolism slows down, nutrient absorption decreases, and the brain, which relies heavily on oxygen and energy, begins to show subtle glitches. All of this is a result of an accumulation of small flaws in the body's systems. Many of these changes are associated with existing chronic diseases, such as heart failure, cancer, chronic obstructive pulmonary disease, or dementia. But they can also occur even in the absence of formal diagnoses. The body gradually prioritizes essential functions and leaves aside less urgent activities. And it is this silent process of disconnection that manifests itself through the signs that we will see below. Is it possible to reverse or delay these signs in the elderly? It is not always possible to completely reverse the signs that indicate the approach of the end of life, but in many cases it is possible to slow its progression or at least alleviate its effects. It all depends on the underlying cause and the body's response to the care offered. For example, if weight loss is linked to digestive problems or malnutrition, dietary adjustments and the use of supplements can help. If the mental confusion is caused by an infection, treatment may bring temporary improvement. The most important thing is to understand that the goal is not always to cure, but to provide quality of life. This means offering comfort, emotional support, and personalized care. The presence of a medical team focused on palliative care can make a huge difference. Therefore, even if the process cannot be interrupted, it can be lived with more dignity, love, and awareness. What happens to the body of an elderly person in the last year of life? During the last year of life, an elderly person's body undergoes gradual but profound transformations. Many of these processes are silent, happening away from the watchful eyes of the family. The immune system weakens, making the body more vulnerable to infections. The muscles wear out, compromising mobility. Appetite decreases. The metabolism slows down. And the brain often begins to show signs of confusion and memory loss. The heart may beat more slowly. Circulation decreases, and the internal organs work less efficiently. Some of these signs may seem small, but they indicate that the body is changing its focus. It stops investing energy in maintaining routine activities and starts to concentrate on basic functions. This is the body's way of preparing for its final transition. Understanding these changes helps to offer more empathy and care in this delicate moment. What are the consequences of ignoring these signs? Ignoring the signs that precede the final phase of life can have painful consequences, both for the elderly person and for their families. When the seriousness of these signs is not recognized, the chance to act in advance is lost. Care can become reactive rather than proactive. Many families, because they do not understand what is happening, insist on invasive treatments, hospitalizations, and procedures that cause more suffering than relief. In addition, valuable moments of connection, goodbyes, and the creation of meaningful memories are lost. Emotional preparation is also affected. Without understanding reality, family members can be taken by surprise, facing grief in a more intense and unstructured way. Recognizing the signs with sensitivity allows you to make more human choices, respect the wishes of the person who is leaving, and live this phase with more serenity. It's about turning the end into a time of presence, affection, and peace. How to offer more humane and conscious care at this stage. Offering more humane and conscious care to someone who is in the final phase of life goes beyond medications and procedures. It is about listening, presence, and respect. It is to understand that many times comfort matters more than healing, and that touch, kind words, and silent understanding can have more value than any treatment. Caring with conscience is allowing the person to maintain their dignity, their wishes to be respected, and to feel welcomed. This may involve palliative care, which prioritizes symptom relief and quality of life. It may mean shifting the focus from the hospital to the home, or adapt the routine to include more moments of presence, shared stories, and tranquility. Every small gesture matters, and when done with empathy, this care transforms the farewell into something lighter, more intimate and meaningful. What tests and evaluations can help identify the decline? Although many signs of decline at the end of life are visible on a daily basis, clinical examinations and medical evaluations are essential to confirm and understand what is happening. Blood tests can reveal malnutrition, chronic inflammation, or organ failure. Cardiologic. Evaluations may indicate heart failure or changes in heart rhythm. Breath tests assess oxygenation and lung function. And imaging tests, such as CT scans or MRIs, help identify hidden diseases, such as tumors or brain lesions. In addition, cognitive assessments, carried out by psychologists or neurologists, help to understand the level of mental confusion and the evolution of conditions such as dementia. But it is important to remember, the objective of these tests is not always to prolong life, but to understand the stage at which the person is. From this information, it is possible to plan more appropriate care, avoid unnecessary medical excesses, and offer an end of life with more peace and dignity. Initial questions were developed. 1. When the body starts to thin. The warning behind unexplained weight loss. Significant, involuntary weight loss in older adults is often one of the first signs that something deeper may be going on. At first it may seem subtle. That belt that needs a new hole, clothes that suddenly become loose, or the simple comment that the person is thinner. Often, these signs are attributed to natural aging or the loss of appetite common in older ages. But when weight loss is persistent, even with the maintenance of food, it is a warning. The body may be signaling that its systems are no longer functioning as they once did. As we age, the body tends to lose muscle mass. But when this loss is accelerated, it indicates that the body may be having difficulty absorbing nutrients or processing proteins, which directly compromises the maintenance of strength and energy. This muscle reduction also weakens the immune system and increases the risk of falls, fractures, and infections. Another important point is appetite. Many elderly people stop feeling hungry or start eating less than before. Foods that were once favorites no longer taste the same. Digestion slows down, and the simple act of eating can become tiring. This isn't just a matter of taste, it's a physiological change. The body begins to understand that it is entering a new phase, a phase of shutting down, and so it no longer sends such strong signals to the brain to seek food or energy. Weight loss can also be associated with underlying chronic diseases, such as cancer, heart failure, kidney disease, or lung disease. Many of these conditions advance silently, with no obvious symptoms until the condition is already compromised. Even emotional issues, such as depression or the beginning of cognitive decline, can directly influence eating. When weight loss continues, even with the encouragement of food, protein drinks, and caloric foods, it is time to observe more carefully. This sign may indicate that the body is prioritizing the essentials and failing to invest energy in secondary functions. Trying to force large meals may not be effective. The focus should be on comfort, offering foods that are easy to chew with a pleasant flavor, and ensure good hydration can bring more benefits than insisting on complete diets. It is essential to remember that at this stage, the goal is to maintain quality of life and not necessarily regain the lost weight. If you notice that someone close to you is losing weight continuously, even eating normally or with help, don't ignore it. This is the body trying to communicate something deeper. Recognizing this message in time can make room for conscious decisions, emotional support, and above all, meaningful moments with the one you love. 2. The tiredness that doesn't go away. Why deep fatigue can be a silent sign of the end. Feeling tired after a busy day is normal. But when fatigue becomes constant, intense, and does not improve with rest, it is time to turn on the alert. This type of deep tiredness is one of the most frequent and visible signs in the last year of an elderly person's life. It is not just physical, it is a total exhaustion, which affects the body, mind, and emotions. Simple activities such as getting out of bed, walking to the kitchen, or changing clothes become exhausting tasks. Even after a good night's sleep or a quiet day, the elderly person remains without energy. This extreme fatigue is linked to the overall functioning of the body. As vital organs begin to slow down, the body starts to conserve energy. The heart no longer pumps blood as strongly. Circulation becomes slower, and the muscles don't get enough oxygen to sustain the same vitality as before. Metabolism also slows down. Energy, which was once used for walking, talking, thinking, or laughing, is now redirected to basic functions such as breathing and keeping the body functioning. It's the body going into preservation.com mode. The person can start sleeping more during the day, take long naps, and still wake up in no mood. Some even show themselves alert at certain times, but minutes later, they fall into a state of sudden exhaustion. This behavior usually confuses family members. It is common to hear phrases such as, "He just needs to try harder," or "He is getting lazy." But it is not a matter of lack of will. It is the body saying that it can no longer function as before. The emotional impact of this fatigue is also profound. Seniors who have always been independent start to feel frustrated for not being able to do what they did before. Shame and fear of addiction can lead them to avoid conversations, social interactions, and even pleasurable activities. This emotional withdrawal can be interpreted as disinterest, but it is often just a way of dealing with constant tiredness. The cycle intensifies. The less a person does, the weaker he feels. And the weaker it is, the less it can react. Breaking this cycle is not always possible. Therefore, the best way is to accept the person's rhythm and adapt the routine. Allowing breaks, respecting limits, avoiding charges, and creating a peaceful environment are attitudes that make a difference. It is at this stage that care needs to be more humane and less demanding. If you notice that someone close to you is always tired, even for no apparent reason, and can no longer maintain their basic activities, listen for this signal. It is the time to offer support, create a safe space, and above all, value moments of presence, even if silent. 3. The mind distancing itself. Confusion and isolation as invisible signs. Have you ever noticed that someone you love has started to forget simple things? Or who is quieter, more distant, and uninterested in conversations? These cognitive and emotional changes are common in the last year of life, but they often go unnoticed. They come slowly, as if the mind is slowly disconnecting from reality. At first, there are small lapses, forgetting where you put your glasses, repeating the same story over and over again. Losing track of the days of samana.com time, the difficulties become more evident. The elderly may be disoriented even in familiar environments, not recognize people close to them, or have difficulty maintaining a simple dialogue. These signs don't just indicate aging. They can be a result of decreased oxygen flow to the brain, caused by reduced blood circulation. The brain, like any other organ, needs energy and nutrients to function. When this fails, cognition also begins to fail. In addition, diseases such as dementia, Alzheimer's, or even infections can accelerate this process. Often, a simple urinary tract infection can cause intense mental confusion in the elderly. But there is something even more subtle and deep: emotional isolation. As the mind tires, social interactions become difficult. Conversations require attention, memory, active listening. Noisy environments can generate confusion and anxiety. Therefore, many elderly people prefer silence, moments alone, distancing. They don't drift away for lack of love or interest, but for exhaustion. This separation can be painful for the family. It is difficult to see someone who was once so present and affectionate become introspective, oblivious, or even indifferent. It may seem that the person is no longer the same, but in fact, it's still there, just accessing the world in a different way. In some cases, these periods of confusion alternate with moments of lucidity. One day the person looks good, the next they are distant. These oscillations are common and part of the process. It is important to remember that even when the words disappear, the affection is still present. A ringtone, a favorite song, a kind look can awaken emotions and connections that speech no longer reaches. The best way to deal with this phase is with patience and empathy. Avoid abrupt corrections or confrontations. Speak softly, keep the environment calm and welcoming, and accept that their time is different from yours. If you notice that someone close to you is increasingly confused, isolated, or emotionally distant, don't ignore it. This can be one of the quietest signs that the body and mind are preparing for the final transition. 4. The body no longer reacts, repeated infections and wounds that don't heal. One of the most obvious signs that the body is losing its ability to recover is the frequency with which infections appear and take time to go away. That flu that used to pass in a few days now lasts for weeks. A urinary tract infection that seems to improve but comes back soon after. Or small wounds on the skin that don't heal as before. These episodes are more than simple discomforts. They reveal that the immune system no longer has the strength to antis.com. Advancing age, the body naturally loses efficiency in its defense mechanisms. But when this intensifies, it is a warning sign. Pneumonias, recurrent urinary tract infections, pressure sores, and skin infections become common. And in many cases, the response to medications is no longer as effective. Antibiotics that used to work quickly now take time to take effect or do not completely solve the problem. The reason lies in the very functioning of the corpo. Slower circulation and declining organs, the transport of nutrients and defense cells is compromised. The body cannot react with the same intensity. In addition, healing becomes a challenge. Simple wounds, such as scrapes, cuts, or bruises, remain open longer, become inflamed easily, and can turn into chronic wounds. In people with reduced mobility, the dreaded bed sores appear, which can develop into serious infections if not properly cared for. Another important aspect is that, in the elderly, infections do not always present the classic symptoms. Don't always expect a high fever, cough, or obvious pain. Often, the first sign of an infection is a drop in lucidity. The person may appear more sleepy, confused, or disinterested. These behavioral changes are a way for the body to warn that something is not right. For families, seeing a loved one fall ill repeatedly is distressing. It is natural to seek answers, exams, treatments, and even successive hospitalizations. But there comes a time when the focus needs to change. Rather than trying to eliminate each infection with intensive treatments, it may be more beneficial to focus on symptom relief and well-being. Maintaining hydration, ensuring proper hygiene, taking care of the skin gently, and providing a peaceful environment can bring more comfort than any antibiotic. That doesn't mean giving up. It means caring with awareness. If you're noticing that your loved one is getting sick frequently, or that small wounds are taking a long time to heal, stop and reflect. Perhaps the body is showing that it is tired. And at this moment, the most important thing is not to fight against the inevitable, but to offer affection, presence, and dignity until the end. 5. Different breathing, compromised circulation. The signs that no one wants to see. Among the most impactful signs of the body in transition are changes in breathing and circulation. These are visible, sometimes frightening, changes that indicate that the body is slowing down. You may notice that the person begins to breathe more slowly, shallowly, or irregularly. At times, there are pauses between breaths, long seconds of silence that seem eternal. This pattern is known as Cheney-Stokes breathing, an alternation between deep, rapid breaths followed by prolonged pauses. It is common in the last months, weeks, or days of life. These changes are not only respiratory. They reflect a general reorganization of the body, which starts to save energy to maintain the functioning of vital organs. And, with that, the circulation also changes. Hands, feet, ears, and even the nose can start to feel cold to the touch. The skin acquires a pale, bluish or mottled tone, especially on the extremities. This happens because the heart can no longer pump blood with enough force, and the body intelligently redirects blood flow to protect essential organs like the brain and heart, leaving the extremities in the background. Other signs may include shortness of breath when speaking, moving, or even resting. The person may start breathing more through their mouths, need frequent pauses during conversations, or show fatigue just by changing positions. This discomfort often makes them prefer to sleep with their heads elevated, use several pillows, or even sit in armchairs. Some older people also develop a mild cough, noises when breathing, or a feeling of heaviness in the chest, which can indicate fluid accumulation in the lungs. These changes are distressing for those who observe. It is natural for family members to try to help. Take a deep breath, calm down. Let's go to the hospital. But in many cases, these changes do not indicate an emergency that can be resolved. They are part of the body's natural shut-off process. Of course, it is essential to have the monitoring of a health professional. But it is equally important to understand that not everything needs to be treated with aggressive intervention. Sometimes, comfort is more effective than any procedure. Keeping the environment cool, using an air humidifier, offering small sips of water, or moistening your lips can bring immediate relief. In more uncomfortable cases, the use of oxygen or medication may be indicated by a doctor to improve breathing. But above all, the essential thing is to ensure that the person feels safe, cared for, and at peace. If you notice these signs, altered breathing, cold extremities, bluish skin, understand, the body is conserving energy. And perhaps what makes the most difference now is her silent presence. A caress on the hand and the certainty that she is not alone. 6. Sleepless nights and excessive sleep. What sleep changes are saying about the body. Sleep is one of the most important functions of the human body. It is during sleep that the body recovers, regulates hormones, strengthens the immune system, and processes memories. But as life nears its end, the sleep pattern changes dramatically. These changes can be confusing, both for those who are living and for those who are caregiving. Some elderly people start sleeping too much. They spend a good part of the day lying down, napping at irregular times, and getting sleepier and sleepier. Others have the opposite: constant insomnia, difficulty falling asleep, or waking up several times during the night. In many cases, the sleep cycle is reversed. The person sleeps during the day and stays awake at night, which can cause exhaustion for both them and their caregivers. These changes are not random. They reflect a neurological and metabolic imbalance that arises when the body begins to shut down. The brain loses its ability to regulate the circadian rhythm, that biological clock that makes us stay awake during the day and sleep at night. In addition, factors such as chronic pain, anxiety, difficulty breathing, and medications also influence sleep quality. Another important factor is the energia.com, less energy available. The body enters a constant state of tiredness. Even after sleeping for hours, the person may continue to feel sleepy or appear lethargic. This is because sleep, in these cases, no longer fulfills its restorative function as before. And when the body enters its final phase, sleeping more also becomes a way to protect itself. It is as if the organism is withdrawing, spending only the minimum necessary to continue. For caregivers, this behavior can be difficult to accept. It is common to hear, "But he only sleeps. She doesn't feel like doing anything anymore." But in fact, this excess of sleep is a sign that the body is prioritizing the essentials. Trying to force the person to stay awake or maintain a strict routine can be more harmful than helpful. At this stage, the best thing to do is to adapt to the rhythm of the elderly. Allow him to sleep when he feels the need. Create a calm environment with soft light, little noise, and thermal comfort. And above all, enjoy the moments of vigil with true presence, even if they are brief. If the person is awake for a few minutes, be there. Hold your hand, tell a story, or just be silent. These moments, however short, can become deeply meaningful. If you are noticing changes in the sleep pattern of someone you love, understand. The body is changing rhythm. And in this new time, rest is not a sign of laziness, but of transition. 7. When life loses its color, the dangerous disinterest in the things that gave pleasure. Imagine someone who has always liked to listen to music, watch soap operas, or take care of plants. Suddenly, this person stops doing all of this, not because of lack of time, but because he simply loses interest. This disinterest in activities that once brought joy is a deep and quiet emotional sign of the end of life. In the last year, it is common for elderly people to lose enthusiasm for what they once loved. Visits become rare, the radio is turned off, books remain closed, and even favorite meals lose their flavor. This disconnection has several causes. The most evident is physical exhaustion. With little energy available, any action requires an effort that can be too much. Even holding a book or leaving the house becomes a challenge. Chronic pain, the effects of medications, and diseases such as Alzheimer's also play a role, affecting pleasure, focus, and motivation. In the emotional field, feelings of sadness, loneliness, and anxiety are common. Often the elderly realize that they are approaching the end, even without hearing it from anyone. And then a process of recollection begins, a search for silence and inner reconnection. For the family, this behavior can seem like abandonment or depression, but in fact, it is a natural response of the body, mind, and spirit. At this moment, the most important thing is to respect. Be present. Offer affection without demanding interaction. A simple gesture, such as holding your hand in silence, can say a lot. If someone close to you starts to move away from your passions, watch it carefully. It can be a sign that life is entering a new chapter, and it's our role to make it as loving and welcoming as possible. 8. Small things, big challenges. The invisible struggle to accomplish simple tasks. Simple tasks such as combing their hair, brushing their teeth, or climbing a step can become major challenges in the last year of an older person's life. This often silent functional decline is a clear sign that the body is losing its capacity. Initially, one may notice a slight difficulty in opening vials or getting up from a chair. Over time, activities such as bathing or preparing meals are avoided, requiring effort that was not necessary before. Many elderly people hide these limitations out of fear, shame, or pride, trying to maintain an independence that the body no longer allows. Ignoring these signs is a mistake. Loss of autonomy is linked to reduced muscle mass, weakness, fatigue, and even cognitive decline. Small falls, frequent stumbles, and the fear of falling aggravate the condition, generating a cycle of immobility and worsening health. Therefore, caregivers need to observe subtle changes in behavior and adapt the environment. Removing obstacles, installing grab bars, and offering help with empathy are attitudes that preserve safety and dignity. Even more important is to adapt expectations. The focus is no longer on independence at any cost and becomes loving care within limitations. Helping them get up, offering support at mealtimes, being present, all of these communicate, you're not alone. Recognizing that the body is tiring is a gesture of deep connection, which goes beyond medical treatments. Talking about the end of life requires sensitivity, courage, and love. Many have been taught to fear this moment, but facing it clearly can transform everything. The end does not have to be synonymous with suffering. It can be a time of reconnection, of exchanging memories, of silent gestures that convey affection and presence. Preparing for this phase is an act of love, ensuring comfort, dignity, and meaning for those who are leaving. If you are experiencing this process, know that you are not alone. Thousands of families face the same challenges on a daily basis. And while the path is delicate, it can also be beautiful. What matters most is not how much time is left, but how that time is lived. Value the small moments, the looks, the silences shared. They are eternal.